Hi, my name is Amy Pencroft, and I'm going to be talking about Turner syndrome. What is Turner syndrome? Turner syndrome is a sex chromosome abnormality in females resulting from partial or complete absence of one of the X chromosomes. With this condition, it mainly involves females. It is estimated that more than 70,000 women and girls in the United States have Turner syndrome, which makes it one of the most common genetic disorders of females. Pathophysiology. Monosomies occur when a normal gamete unties with a gamete that is missing a chromosome. In this case, the individual has only 45 chromosomes and is said to be monosomic. Although the exact cause of Turner syndrome is not known, it appears to occur as a result of a random error during the formation of either eggs or sperm. Diagnosis for Turner syndrome is confirmed by a blood test called karyotype, which is used to analyze chromosomal composition of a female, which on the previous slide is a picture of what a karyotype is. Turner syndrome is being increasingly diagnosed before birth based on chromosomal analysis performed subsequent to amniocentesis or chronic venous sampling. The picture of the ultrasound shows nuchal translucency in the back of the neck, which is a sign of Turner syndrome because of the large fluid collection that can occur. Signs and symptoms of Turner syndrome. The picture I have provided are the common signs and symptoms of what you might see on appearance of people who have been diagnosed with Turner syndrome, such as the wide web-like appearance of the neck, shield-shaped appearance of the chest, low-set ears, and the main indicator is short stature. But there are other signs and symptoms that do not occur to the naked eye, such as the kidney abnormalities with the horseshoe kidney, or even an absence of a kidney. Thyroid disease, gonadal dysgenesis, which is failure of the ovaries to develop properly. Intelligence is usually normal with people who have been diagnosed with Turner syndrome, but some may have difficulties with directional sense, math, nonverbal memory, and attention. They are at greater risk for developing certain disorders such as osteoporosis, diabetes, and celiac disease. Outcomes and expectations. Turner syndrome is a lifelong condition in which most people live long and healthy lives, yet some are more susceptible to numerous chronic conditions, such as congenital heart defects with coarctation of aorta, a condition characterized by narrowing of aorta, which causes the heart to pump harder in order to force blood through the constricted aorta, which can increase risk of severe, life-threatening complications including high blood pressure of arteries of the lungs, or aortic dissection, a condition in which there is a tear in the inner wall of the aorta. Treatment of Turner syndrome. I just want to start off by saying that there is no cure for Turner syndrome. There are just ways to help with the symptoms. Pharmacological ways are growth hormone injections, which can begin in early childhood and may increase final adult height by a few inches. Estrogen replacement is usually started at time of normal puberty, around 12 years, to start breast development. Estrogen and progesterone given a little later to begin a monthly menstrual cycle, and later on when they become older, they may need in vitro fertilization. Some non-pharmacological ways are regular checkups to make sure they're developing in the right track. Counseling, especially when they're in the age group of puberty, it might be harder for them to realize that their friends are maturing faster than what they are. And then children are more likely to use the pens that are shown on the picture is because it's easier for them to do self-injections with them. Patient-centered education. Make sure that parents understand how to do growth hormone injections, and making sure that it's important to keep to the schedule of the injections. You want to explain the importance of exercising regularly to help prevent heart defects and osteoporosis for when they become older. You want to explain the adequate amount of vitamin D and calcium in their diet, counseling for when they get older, and consistently follow up with checkups, especially around puberty, to help with the growth hormone injections and for the estrogen replacement so they can get the breast development and the monthly menstrual cycle. Nursing interventions. Help administer the prescribed medication of the growth hormone injection subcutaneously. Also show the patient and the parent how to do it themselves. Check blood pressure and blood sugar because they might be diagnosed with high blood pressure and diabetes. Listen to the patient describe how they see themselves because Since you might see them throughout their whole lifespan, they might trust you more than they might trust a counselor. Monitor their child's growth and developmental status. The main reason why they're there is because they're diagnosed with Turner syndrome, so they're not developing normally like any other kids their own age. Work collaboratively with other healthcare professionals and with the patient and family in developing a plan of care. Because not only are they diagnosed with Turner syndrome, they might have a congenital heart defect or diabetes. But all of those working together helps the child process everything better. Question 1. A female fetus is in utero showing signs of a large fluid collection on the back of the neck and has a heart abnormality by the findings. What should the doctor suspect? A. Down syndrome, B. Turner syndrome, C. Fragile X syndrome, and D. Angelman syndrome. The correct answer is B. Turner syndrome because it's a female, the large fluid collection in the back of the neck, and because there is a heart defect or huge indicators of Turner syndrome. Question 2. A nurse is giving instructions to a parent that will help their child's symptoms with Turner syndrome. What should she include in the teaching? Select all that apply. A. Vitamin D, B. Sedatives, C. Calcium, D. Exercise, E. Folic acid. Correct answers are A, C, and D, which are vitamin D and calcium and exercise. The vitamin D and calcium are to help with osteoporosis, and exercise are for osteoporosis and for preventing heart defects. Here are my references that I have used throughout my presentation, and thank you for listening to my presentation about Turner syndrome.